Loetscher here. So I want to talk to you a little bit about recovering from dental implants. And there's kind of three ways I look at this. One is a single implant, straightforward case. Number two is an implant with some bone grafting. And the third way I look at it is a full set of teeth on implants that we do, converting someone's teeth to implants. So one of the common procedures we do is putting a single implant. Quite often someone will break off a front tooth, be an emergency situation. They'll come in, we'll put them to sleep. We take the tooth out, put an implant in, make a provisional tooth right there, mill it in the lab, and they leave with a front tooth. And those patients the next day, it's almost like nothing happened. In general, most of those patients don't have any pain. If it's right in the front of your mouth, you might have a little ache up in this area for the day. But in the back of the mouth, it's almost like we didn't even work on them. So really quick, easy recovery. We're on antibiotics for 5 days. The other thing that we do is a lot of implants in the back of the mouth need some bone grafting, like a sinus lift. We might harvest some bone from the lower jaw. And for those patients, it's a little bit of a bigger procedure. They're going to have some puffiness for 3 or 4 days. But even so, the next day, a lot of people go to work, they get back to their normal activities, but they might be a little sore for a couple of days because it's a little bit bigger procedure. The third thing we do quite a bit of are take someone's teeth out and put in maybe 6 implants per dental arch and provide them with a whole new set of teeth. And for those patients that are asleep for several hours, getting the teeth taken out, new implants put in, and it seems like a lot, but believe it or not, it's not very invasive. And those patients, they wake up, we give them the Novocaine that keeps them numb for 10 or 12 hours, and they'll go home, and the next day, a lot of people don't need narcotics. They might not, but they'll come in and see us the next day. Sometimes we gave them the teeth the day we did it. Sometimes they come, we screw in a whole set of teeth the next day, and they're not even on pain medications. Unless we did some bone grafting, then they might be on some pain medication. But in general, it's pretty shocking how easy the recovery is from this. And if we do bone grafting, you're on antibiotics for about 10 days. Otherwise, it's about 5 days. We give people narcotics, and a lot of patients don't use narcotics. Even some of the procedures with people have no bone, we take bone from their hip and rebuild their jaw. Those patients, I did a study on that one time, and like 70% of them didn't use a narcotic after 2 days. So dental implant surgery in general is very easily recovered from. You have to be kind of soft foods, not abrasive foods for a couple of days, but it's a quick recovery.